All right, thanks, Tom. It's just really, really interesting to hear the work being done at Forest Close, and thank you so much for the team there for sharing, and also Julie and Nottinghamshire also for sharing what they've been doing there. And much of it you've kind of already set us up, Tom, because a lot of the things that were mentioned just in the last presentation, Lee, I was thinking about what you'd said at the very beginning with that quote about it being the process is just as important as the change ideas that teams are making. So, which really lends itself nicely to the next section Emily and I are going to be covering, which is all about scale up and spread. Emily, if you could move to the next slide, please. Thank you. So in this session, we'll be focusing on the later stage of your QI journey, which is all about scale up and spread, as I just said. And here you can see the sequence of improvement. In the last learning set, we covered the implementation stage, but here you can see how, which was essentially about taking your change ideas that have contributed to significant improvements on your ward. So the changes that you want to keep. So the changes that Julie mentioned in their service, and Lee and the team mentioned in Sheffield as well. That those are the sort of things that clearly are working well, that people want to try and have others learn from. So you can see it's all about making those changes that have contributed to those significant improvements on your ward and making them part of your normal day-to-day practice. And the aim of this is for your new ways of working and your improved outcomes to become the norm. So in other words, for you to sustain your improvements. For most of you, this will start to kind of happen after the collaborative has finished. But what kind of happens after that? Emily, if you could move to the next slide for me, please. This is where we really want to kind of cover what we mean when we say scale up and spread. So by scale up, we mean testing your new ways of working with an increased number of teams. So for example, with other wards in your unit and hospital, which the team in Sheffield just talked about, to test those ideas in different systems, infrastructures, and overcome any problems that might arise. And to increase confidence that these changes that you're going to be making work in each care setting. So that really covers the concept of what we mean when we talk about scale up, but also when we're talking about spread. That's really when your proven interventions or your new ways of working are implemented consistently and reliably across the whole system, so across the whole hospital or the trust. And remember, when scaling up and spreading change, you're not necessarily spreading the exact same method to each part of your system. So, you know, for example, your change ideas might not necessarily work exactly the same on an acute ward as it does on a rehab ward. That's why when scaling up your test, you test the ideas in different settings and you adapt it as you go along. And the aim when you're spreading change is to spread the best practice, not necessarily to introduce a particular idea to every ward in your trust, for example. We know obviously scaling up and spreading change takes a lot of planning. And we know some of you have already started to think about planning to start scaling up and spreading change within your trusts, as we've already just heard with the two teams that have just talked about that. So it does require a lot of planning. Emily, I'll hand over to you.
Thank you. So yes, I agree. As Lee, when you were talking, I was thinking our work here is done in a way. You've given some just really great practical examples as to, you know, how things work best. And when you said it's the process, is not is as if not more important than the change ideas. But there is a resource from the IHI, the Institute for Healthcare Improvement, and they have the 7 spreadly sins. So it sort of flips things on its head a bit, but I quite like the way that they're worded, and maybe you do too, in the way that there might be some things on the screen that sort of chime with how we do see things being implemented in organisations. So it's things such as Saiqa said there, having change ideas, but testing them in a range of different settings. And as Lee said earlier, what works for one ward is not necessarily going to work for another. And I think we often quite, in organisations, rely on one person to implement something or undertake a project. But it's quite good to keep in mind the way that we have set up or encourage you to set up project teams. So having someone leading it, someone senior in the trust that can sponsor and support and unblock barriers, having quality improvement support, that same way of working and that same framework is also really key in scale up and spread as well. And also relying solely on individuals' vigilance and hard work resonates with what the team at Forest Close said about it's really important to have protected time to work on this project, and that also applies when it comes to scale up and spread as well. And again, adapting to different settings and different ways of working. This topic is very different to others. It takes time, as we all know. We've been working on this for a while. We're still, it's taken a while for, understandably, for everyone to get comfortable talking about sexual safety, increasing their confidence in talking about sex in general. So that's something that's definitely something for trusts to keep in mind when thinking about scaling up and spreading the work of the teams that are involved in the collaborative. And relying on the team who drove the initial improvements to implement across the whole trust. So it's really key that the original team are involved to share the learning and the insights, but for that to go hand in hand with a project lead, someone senior in the trust that can really sort of scale up and spread this work. And as you all know by now, measurement is really key in quality improvement. So, but checking that data often to really keep in touch with what's going on in terms of the scale up and spread. And also finally, not expecting huge improvements. And as I say, particularly with this topic area, it takes time for teams to get comfortable talking about it. So saying, these are things to implement. It's not going to necessarily, people can't hit the ground running because it does take time. It needs to happen a little bit more organically than that. So, and it links as well with what Lee said about space for people to feel able and comfortable to talk about sexual safety. So we have a worksheet that you can work through. We're going to put a link on our website to it. And that's for you to work through if you're a senior sponsor or if you're a team and there might be a sexual safety working group in your trust that are really, obviously, understandably really interested in the work that you're doing. So it might be something that you can work with them together to think about how to scale up and spread. And I really do think that the process is really key here. It's not necessarily just what you've done, but also how you've done it, and to be really honest in sharing your experiences within your trust as to what has worked for you and how you've managed to undertake this work and increase everyone's confidence and changing the culture on the ward to talk more about sexual safety. So we'd just like to spend the last, 20 minutes or so, or however long you'd like to discuss for, just talking really about how have you shared within your trust, how have you shared the work that you've been doing, or if you're either on a QI team or a senior sponsor, if you have any plans to scale up or anything really that's happening within your trust to sort of celebrate and share the great work that you're doing. So feel free to either raise your hand or take yourself off mute. We'd love to hear just a couple of examples, because it also might inspire others on the call as well as to different ways and methods that others would be able to share. Hi, Tracy.
Hi. Yeah, all right. So the idea that we've had is to kind of take a three-staged approach at it and do a condensed version of what we've done within the project. But we would do it by speciality, because I think the barriers that and the challenges that you might face in older persons would be very different to adolescent units, to rehab units, etc. So we were going to have a meeting running every week for 6 weeks, depending on the different speciality, and pretty much mimic, in a sense, if you like, a bit what yourselves did. Would have a service user with lived experience. We would talk about how to set up the project team, what that would look like, the bi-weekly meetings, the data collection, all that kind of thing, and set people away within their localities of starting that. And then we're going to so that'll start in October is the hope, and then in January we would then bring people back together again within those 6 individual groups, talk about how things have gone, how they find, what they've done, feedback so far, do things feel safe or not. And then talk about the change driver process, PDSAs, what we've done on the ward ourselves, what we've learned, share our practices and things, set them away on that, and come back 3 months later to then do the final bit of, again, meeting, how's everything gone, all that kind of thing. And then the hope would be that those specialty services would then maintain that on a monthly basis by having a meeting as a service to kind of share good practices, ideas, barriers, changes, and keep the momentum going. We're going to run trauma training alongside it for people to, because often what comes through is that people don't have the confidence to respond, a bit like what was said before, worrying that they're going to have to deliver this specialist CBT approach, when actually it's not. It's just about thanking the people for sharing, their disclosure and things like that, and being caring and compassionate, and looking at how we can evaluate it. So we had a rough idea of doing it along those lines, because it's a cultural thing, isn't it? It's about people building their confidence and gaining experience. So we really want to help people work through that process themselves, rather than say this is what we've done and go away and crack on and do it, if that makes sense. So I hope you managed to hear that, because my screen's freezing with yourselves on it quite a bit, so I'm not sure if it's me freezing or you.
No, we
You did. Champion.
We did hear you clearly there. Thank you so much for sharing, because I was thinking about what Clearbrook have been doing, and I know that within your trust they kind of look to you guys as kind of the example of how this work has gone. But as you just said at the very beginning there, you described what we've been saying, that there's a lot of planning that needs to be involved. It's not just going straight to, okay, this is what Clearbrook have done, and then okay, we're going to mimic exactly that, because for each setting and service it's going to be different. That's going to look different. So the planning is key, and I'm glad you pointed that out.
Yeah, so I mean, I've met with the sponsorship, and he's really keen to roll it forward this way. And when we do the person with lived experience, it would be in relation to that service. So I'm very lucky, and the nurse consultant's got a massive trauma background in terms of what she's working. So for the children's services, she would have some person who's been in child services who hadn't felt safe historically on a ward. So it would make it really meaningful. We've got innovations involved, so we can set up our own dashboards and things, and how to monitor the data going in. And so there's lots and lots of work going into it. And Saiqa, I've just sent you a separate email to say, have you got capacity to come to our bi-weekly tomorrow, just to kind of
I'll be
talk
there.
around our ideas. Fab, just to talk around our ideas for any additional thoughts around it. So that's it from me.
Thanks, Tracy.
Yeah, that sounds brilliant. Keep in touch, because I'd love to hear how that goes. It just shows the far-reaching nature of the work that we're doing at the moment. And Lee, I can see you've put some more nuggets of information in the chat. I didn't know if you wanted to talk a little bit more about that.
Yeah, I can do. I just reflecting on what you talk about sustainability, and I think the question about sustainability differs at different stages of the journey. So what Forest Close has done is get those important conditions which have allowed ownership and for a collective understanding to develop, and that's kind of like the bedrock and the fertile ground for anything else to happen. So that's kind of like the first stage of it. But even with Forest Close, where they've got the conditions in place, there's a big question about sustainability and how do we make sure that these great ideas last. And I think we're at the stage now is we've trialed a number of change ideas, and we feel that they're as good as they can be. The question now is to make sure that they can become standardized and happen routinely. And I suppose that's where the conversation moves on to the process measures, to think, okay, over these next 2 months, for instance, this idea about screening on admission, our process measure to test that idea is happening in a sustainable way is we're going to simply measure, was every admission screened? And that will give us objective data to see if it is being sustained. And if it's not being sustained, then we can have a helpful conversation about, okay, why hasn't it happened on every admission? And I suppose it's never abandon the learning on this, because even when you've got change ideas, the learning comes from as you're trying to implement it. Because too often in all walks of life, we come up with an idea and then go ahead with it, and then 6 months later we wonder why we haven't seen the outcomes we wanted. And it wasn't because it was a bad change idea, it's because that change idea never happened as we'd planned. So it's just that kind of reflection, I think.
Yeah, and links in as well with a little bit about the implementation that we spoke about at the last learning set. We always say, will these change ideas carry on if you as a project team went on the ward? So yeah, I think that's really helpful. Thank you.
Kate's put in some useful thoughts in the chat. Kate, I don't know whether you want to expand on what you've just said there, because I think it'd be really beneficial for teams to hear a bit more.
Yeah, hi. So it's something that I think I talk about quite often in these settings. But Forest Close are one of my wards, and I have to say that I think I've told every ward that I've spoken to since then that they should really think about the staff questionnaire. I think with hindsight on this collaborative, we might have made a questionnaire of that sort a sort of mandatory part of the starting point. So in the same way that you're measuring feelings of sexual safety and reduce and incident numbers, I always say to anybody thinking about doing this work is use a measure that will give you an idea of how improved your staff are at dealing with this subject, because I think, as Tom alluded to earlier, and we've talked about sort of throughout the session today, it's something that we underestimated a little, I think, just how difficult it would be to get started with those conversations, how hard it is for people to really talk openly about the subject or to know how to. And so I think you'd very easily, if you built that in as a standard part of your measurement, you'd very easily see quantitative data improvements before you might see them in the feelings of sexual safety and in reduced incidents. So I hope that makes sense. If there are any questions about that, then let me know. I'm not suggesting you replace any of the current measurement with it, but I'm just suggesting adding it to it. Yeah.
Thank you, Kate.
Thank you. Are there any other questions or thoughts anybody would like to share? I can see, Amanda, you've asked whether the questionnaire is going to be put on the website.
Sorry, I was just going to say it's already on the website. Some time ago, actually, when Forest Close first started using it, we put it up there. So you've got the questionnaire itself, which you can adapt for your own setting, but you've also got a video very expertly recorded by Lee explaining kind of how they used it and what the utility of it was for you to use too.
So we'll put a link to that in the chat as well. It's on sort of our landing page with our additional resources in, a really helpful resource. So are there any final questions or anything that you'd like to share on Scale Up and Spread, or any reflections on the learning set and the great work that we've heard about today? No, I think everyone's just maybe inspired and ready to get on with their afternoon. So good. Any final comments or anything from the team? Or Tom, I didn't know if you wanted to close as you opened.
I can do, yeah. So everyone can have a bonus 10 minutes to stretch the legs. My watch has told me I should stand up twice already in this session, so maybe that's a good idea for everyone. It's been a really, really interesting session. Thank you so much to Julie and Lee and Juliet and the other Julie and Michelle. Please, I remembered everyone's name there, and also to Emily and Saiqa for taking us through that. It's really interesting to think about, actually some of the really. So sometimes I think with this collaborative, because there haven't been, perhaps in the same way as some other improvement work, lots and lots of different sorts of things being tested, and actually there's been a lot of focus on the stuff we've talked about today. So how you talk about sex and sexual safety, how you kind of create an environment that's safe, and that's quite slow, in-depth work. Although I don't want to say it's slow too much, because I completely agree with Lee's point about if the conditions are right, change can happen quite quickly. But it's been really great actually to just reflect on how far people have come listening to the presentations today. So thank you so much for that, and to be thinking about what next, how this is spread more widely in the trust. And we've got we're coming close to the end of our time on the collaborative. So in September, that'll be the sort of last time we come together. We really want to try and make sure we're capturing people's stories, capturing the kind of key work, including the learning from things that haven't gone so well as well. And we really want you to work with your coaches to produce some way of capturing that, whether it's a storyboard or a poster or any way that's kind of as easy and impactful as you can. Michelle, I'm just going to go back to you because you've got your hand up.
Yeah, I think I wanted to just kind of tell you that, because this presentation is a couple of weeks old now, really. And since then, we've kind of like looked at, we felt as if like, so what are we going to do now with this information? We've had the training, and what it feels as if we're a bit barren almost at the minute, as if it's getting not forgotten about, but we still need to keep that momentum up. So, and interestingly, we've sent a service user questionnaire out asking similar things as what we were asking the staff. How do they feel about talking about these subjects? If we were going to do a discussion group, what subjects would they like to be talked about? Would they like to find out about? And but I think we haven't had all of that information back yet. But the information that we have had so far, which has surprised me, is that quite a lot of the clients actually don't want to talk about it. So that's been quite interesting as well. It wasn't quite what I was expecting, But that's okay as well, because I think ultimately, as long as the staff feel equipped and confident to be able to deal with these situations as they arise, and that's different. So now me and Juliet are left kind of like, what we're going to do is target our staff and go around and do kind of like fortnightly sessions on each of the bungalows.
We're trying to get the momentum going again, because we feel as though it's dipped a little bit, and as it's been mentioned before, it feels almost as though, because we're kind of driving it belongs to us, and it's everybody's business. Yeah. So we're trying to kind of get that back in, incorporated back into the ward teams. And what we thought about was that we're going to just do like drop-in sessions on each ward, and just to kind of get the topic going again. Yeah. We're calling it "Is It Taboo?" because we think it's something that people will kind of not run away from. So we're hoping to kind of, get the momentum going again by, going to the wards. But what we'd ultimately like to do as well is involve service users. Yeah. We'd like to do a joint thing between the ward staff and service users talking about, is it taboo? Yeah. So that's the next stage, what we're looking at, where we're at now.
Yeah, I kind of felt as if this isn't a completed piece of work that we've been doing, and it feels as if it's been presented as if, hey, look at that, isn't it great? When actually that bit was quite great, but now it's kind of fallen by the wayside a bit, and we need to pick it. We need to carry on running with this and make it meaningful still, And I think I felt like it was important for us to share that with you about how we're carrying that on, really. And I'll shut up now. Thanks.
Thank you.
Thank you, Michelle. I think that's a really helpful reflection, and one of the patient reps that we work with on some of our QI projects, when she talks about quality improvement, she tries to ban anyone using the term project. She says they're not projects because there's not an end point, and actually this work doesn't end, and it keeps going, and that kind of cycles of renewing the momentum and trying new things and expanding it is really important, and I think that's a really good reflection to end on probably. So thank you so much, everyone, again.